Professionals say a certain test is helping patients with diabetes. It's called the A1C test, and it's critical both for patients with diabetes and for those who may be pre-diabetic. Here's CBS 21's Chris Nallen with this week's Doc Talk.
Well, the A1C test monitors glucose levels, making sure patients with diabetes stay within a healthy glucose range. This test could also motivate the patient to lead a healthier life.
The following segment is sponsored by Geisinger Holy Spirit.
It helps them to realize that, oh, my A1C started out at a 9, now it's down to 8. Maybe I am on a good track.
The hemoglobin A1C test helps doctors determine if a patient has diabetes, and more often for patients with the disease, the test measures how well it is controlled.
What is more important is making sure that blood sugars are staying within a safe range.
Erica Italiano is a diabetes educator.
When they check their blood sugars, they're just getting one pinpoint of a day.
She explains how the A1C compares to a fasting glucose test.
That A1C tells us over the long run what's actually happening. The A1C test does not have to be done fasting. It can be done at any time of the day, and what they ate the day before has nothing to do with what that A1C is going to equate to.
The A1C ranks the estimated average blood sugar level. A person who doesn't have diabetes will have an A1C of 5.7% or lower. Pre-diabetic range will be between 5.7 and 6.5. Higher numbers places you in a diabetic range.
If we can keep their A1C below 7%, that puts them at less chance of developing diabetes-related complications.
That's why further testing is key.
We recommend it be checked every 3 to 6 months, depending on how well their diabetes is controlled.
For controlled levels, Italiano suggests you take your medications properly, along with working on your exercise habits and your daily diet.
Avoid sugar-sweetened beverages. That includes soda, sweetened teas, even juices. 100% fruit juice is still pure sugar.
Also, eating less carbohydrates like breads and pastas will help keep your glucose levels down, dropping your A1C. With this week's Doc Talk, Chris Nallen, CBS 21 News.